the Human Service Commission president. Our commission secretary will take roll call, then provide instructions for comment.
Good morning, Commissioner. Thank you. Commissioners, please respond to the president when I call you.
President Khan. Vice President McRae.
Present.
Commissioner Kogler McDonald. Commissioner Semmel has an excused absence, and Commissioner Singh has approval to attend remotely, but it doesn't look like he has had success logging in from what I can tell. So when he does, I will let you know. But we do have a quorum with the three of you. Thank you. So public comment will be available on each item on this agenda and during general public comment at the end. Each speaker will be allowed 3 minutes to speak. The public are attending this meeting via WebEx online and via conference call. During each public comment period, remote attendees will be instructed to. So for WebEx attendees, use the raise your hand feature when the commission secretary announces public comment. The meeting moderator will call on you when it is your turn. And then for callers, you should be dialed in at this point, 415-655-0001. You'll be prompted to enter access code 2598-599-1145#. And then you may be asked for a password, which is 7650#. After the moderator closes the WebEx public comment, here I will announce public comment for the callers. When connected through the phone, you will hear the meeting discussions, but you will be muted and in listening mode only. When your item of interest comes up, dial *3 to be added to the speaker line. Best practices are to call from a quiet location, speak clearly and slowly, and turn down your TV or radio. You will have 3 minutes to speak, as I already said. You will be informed by the moderator when you have 30 seconds left. After 30 seconds, you will be muted automatically and placed back into listening mode. For callers, if you have any issues with muting, unmuting, it's *6. We should also be able to assist you with that on our end. Okay, moving on the agenda. Item 2 is the adoption of the agenda. Are there any comments or questions from the commission regarding the agenda? No? Is there any public comments? We're gonna look on our portal here to see if anybody's raising their hand. Is there anyone in the queue? Okay, seeing no public comments. Is there a motion to approve the agenda?
Second.
All in favor?
Aye.
Oh. Yeah. Are you sure?
Yeah.
Okay, okay.
All right, item number 4, item number 3 is adoption of the March 23rd regular meeting minutes. Are there any comments or questions from the commissioners? Nope. Is there any public comment? Moderator, please open WebEx and the phone line for public comment. We'll wait for just a second. Do we have any callers or attendees in the queue? No. Okay. Closing public comments. Is there a motion to approve the minutes?
Second.
All right, all in favor? Thank you. Item number 4 is the executive director's report. Executive Director Rohr, your turn.
Thank you, Ms. Warren. Good morning. Someone shortened my microphone. Or I grew. Good morning, President Khan, commissioners. Nice to see you all. I'll start at the federal level. I normally do. There's been a few hearings, both in the House and the Senate, that are showing, I think, a troubling trend from the Republicans in Congress on rehashing work requirements for a lot of our safety net programs. And so the Farm Bill right now, which authorizes CalFresh in California, through SNAP, the federal SNAP program. You know, the Republicans focused on increasing work requirements, talked about eliminating loopholes at the state levels that are exempting what they said are far too many people from the work requirements. The Democrats in the committee focused on shrinking benefit levels and the need being still great in the country. So I just raised this because we're seeing this kind of pattern come from the right and coming from probably the House over to the Senate in budget proposals, as well as debt ceiling limit proposals as well. In fact, in the deficit reduction measure, there are tightening work requirements for single adults on SNAP, CalFresh, also work requirements for Medi-Cal for able-bodied adults, which is something that we have long opposed, linking work requirements with vital safety net services like food and healthcare. And so the Dems, you know, this likely dead on arrival in the Senate, and the Democrats will hold the line, but it is a bit of a troubling trend that's rearing its head once again. Sort of consistent with that, the House Ways and Means Committee held a hearing on TANF, which, as you know, is the federal program that authorizes CalWORKs. It's the first TANF hearing in a number of years. They titled the hearing, Welfare is Broken, Returning Work Requirements. So again, really focusing on increasing requirements in order to receive what is a relatively small amount of cash benefit. The Republicans indicated there would be more hearings on TANF. It's been operating under a continuous reauthorization for a number of years, and so they haven't gone into the statute at all to amend anything, to change anything. They just basically re-up the funding, but it looks like that the Republicans are going to want to open this up again. So we'll keep monitoring that to see if there are impacts or changes that would certainly impact our programs. At the state level, we're waiting for the May budget revision to come, typically around May 10th. It looks like there's going to be additional reductions or additional proposed reductions similar to what we've had to do locally, which I'll mention in a second. Revenues are projected to come in lower than they were in January, than the projection in January. But there's another sort of factor this year in the May revise, and that is for most of California counties, the tax deadline was extended to October, consistent with what the federal government's allowing because of the emergency declarations due to the floods. So the reason I'm raising this is because typically what the May revise does is it takes real tax receipts that they get in April and then uses that to project their revenues, but it's revenues based on actuals. It's not a projection like they do in January, which really is why they have a May revise to get better numbers. Well, because the tax receipts in the majority of California aren't coming in until October, we're basically getting a May revise that's more projections on projections. I don't know how that's going to bear out in terms of how they negotiate the budget and what they come up with, but it could look like something like a temporary budget that would then be renegotiated in October when they get actual receipts. They could have a lot of contingencies in there, so they're not operating from deficit reduction from a budget deficit right away. So it's unknown, but I just pointed out because it's certainly the first time that this has happened. I don't know if there'll be an October budget revision, but I suppose they could do that as well. So we'll know more in a few weeks, and I'll report back in the May meeting on the implications for our programs. So locally, similar to the state, the 9-month the forecast for 9 months that the controller released at the end of March or early April showed about $90 million additional budget deficit than was assumed in December. So the mayor's budget office has asked departments across the city for additional reductions. Ours was another $2 million in general fund, and then options for an additional $3 million. So sort of what does that mean? It means we'll give them $2 million of reductions, but they want to see if they needed to go even deeper, what that would look like. So again, given the mechanics of our budget, which Dan Kaplan has explained it to you a lot, we have a lot of state and federal revenue, and a lot of our local dollars are required to match or to leverage those federal and state dollars. And so those are off the table. So our reductions of 2 to 3 million compared to a budget of across the agency of 1.2, 1.3 billion, of which general fund is about a third of that. 2 million is not very large. So we're able to achieve this through looking at different revenue sources, looking at attrition savings through staff vacancies, and then looking at contract savings, which is sort of money that's not spent by our contractors. So even though we have additional cuts, there's no real sort of quote unquote service cuts. There's certainly no implications for staff. This budget, and the mayor's been firm about this, will, even if the deficit grows, it's not going to include layoffs in the city at all. The mayor's been very firm about that. So we'll see if the 2 million is enough to meet the target for June 1st. And even if we have to go through the 3 million, again, it won't impact our services. Just an update, non-budget related locally. If you remember the Museums for All program that we launched or helped launch, which provides free or reduced admission to 22 participating local museums for families who are on public assistance. It started as a summer pilot, but now it's year round. I just want to sort of show the reach of what that program, we never really thought it would be as large as it became, but we've, let's see, over 136,000 people have used the San Francisco Museums for All programs. So for all of the museums admissions, Museums for All accounted for about 4% of all admissions citywide. California Academy of Sciences, which is geared towards kids, we had 76,000 admissions, and then the Exploratorium had another 20,000. So it's being used. It's being used by our families, and I think without that program, they probably wouldn't be bringing their kids to the California Academy of Science, for example, which I think is like $30 for admission, which is, it's expensive. The Children's Creativity Museum, which I actually haven't been to, had the highest rate of Museums for All admissions. 22% of the people who went through the Children's Creativity Museum were from Museums for All, so low-income families. So it's really a neat work that sort of framed around social inclusion work that we've been doing for a little while now. So within the agency, in our administrative division, our diversity, equity, inclusion, and belonging office, we are having our racial equity staff-wide town hall today. It's online at 1 o'clock today. It'll cover our racial equity action plan, 2-year progress report, updates on our employee resource groups, applications for our next racial equity work group, and then applications for the 3rd mentorship cohort that we launched about 2.5 years ago. I do also want to report that the director of our Office of Diversity, Equity, Inclusion, and Belonging, Asa King, has taken a new position. Asa took a position over at Department of Public Health. It's a promotion working on equity issues more broadly around health and in the community. But I just want to, Asa has already started their new job, but I just wanted to publicly thank Asa for their great work in launching our diversity, equity, inclusion, belonging work at the agency and shepherding a lot of great initiatives. So thank you, Asa. And for now, Dr. Katrina Williams, who's our HR director, is acting in Asa's stead. In the communications division, a number of communications that I want to just highlight to you. One is around our free tax help. So in response to the extended tax filing deadline, which I just mentioned, we've updated our website, our social media posts, and our print materials to highlight that you can apply for the free tax help as well as local working families credit and earned income tax credit through October 16th. Continue to spread this message through flyers, mailings, social media, etc. So far, we've had about 2,400 applicants already. So hopefully through the additional months and keep pushing out those messaging, we'll get even more households applying for not only free tax help, but availing themselves of the federal tax credits, the state tax credits, and the local tax credits. We've also been communicating out a lot on the changes in CalFresh and Medi-Cal due to the public health emergency lifting. In April, we send out mailings and texts to all CalFresh households, explaining the reductions in benefits and directing them to other food resources in the community through our community food programs. And also updating about the Medi-Cal renewals, which are resuming. They've already started. They have to, the first set of folks have till the end of June, but again, we're launching a lot of cross-programmatic and interagency communications around that through text, mailings, web updates, social media. We have a Medi-Cal renewal, frequently asked question video, and then communicate presentations in community groups and CBOs. We really want folks to update their addresses, get the paperwork in, because if they don't, they would lose their health insurance through Medi-Cal. So I'll be updating you all monthly on sort of kind of what we're seeing in terms of percent successful renewals and our discontinuance rates. It's data we have to submit to the state on a monthly basis as well. Another neat initiative that we've launched is around immigrant outreach communications, particularly around public charge. So we have what's called the Immigrant Outreach Project, and we identified that public charge or confusions around public charge is one of the main barriers preventing immigrants from applying for public benefits. So to address this, we partnered with the city's Office of Civic Engagement and Immigrant Affairs and the Immigrant Legal Resource Center to facilitate the first ever Zoom webinar with simultaneous Spanish and Cantonese interpretation around public charge, sort of demystifying what public charge is and then other related immigration concerns. We did this on April 19th. We had 198 people registering, 46 requested Spanish interpretation, 13 requested Cantonese interpretation. We ended up having 127 people attend. We got a lot of questions in English and in Spanish. So we'll continue to do this work. It's really, I think it's important when comes from government rather than from a nonprofit or a legal aid. I think hopefully it's taken differently. It comes across as well. It's for the public charge is a fear of government programs. And when government is saying, hey, you can't apply, you're eligible. We want you to take advantage of what you're entitled to receive. Hopefully it's taken better by the population. In our divisions in SF Benefits Net, so CalFresh, the State Department of Social Services got approval for the telephonic signature waiver through March 31st of 24, which means that we can continue to waive the interview requirement on approved cases and collect applications by phone. It's just another way to hopefully simplify the CalFresh application process and get more folks to apply. I mentioned the Medi-Cal. I just wanted to tie numbers to the recertification requirements, just so you get a sense on how many people we're dealing with on a monthly basis. So the number of households who have a June 2023 renewal date, it's 11,517. So obviously it's a huge number. We think about 40% of them can auto renew without any action by the client. So that leaves there's still about 6,000, 6,500 people who actually have to process paper to get this done. Which is again why this communication effort is so important.
You anticipate that number for all the months, correct?
For 12 months, yeah, about the same, exactly. I just want to mention Senate Bill 260 because it is related. It passed last year, and it really is addressing sort of the gap that it can occur when someone loses their Medi-Cal, and it automatically transitions Medi-Cal households into Covered California, into the lowest cost plan. The beneficiaries can choose not to do that as well if they don't want it, but it does sort of, it's kind of like operates kind of like COBRA, right? When you change a job or lose a job, you have an option to continue. You have to pay in order to do that, but it does try to avoid a lapse in health insurance. A couple of community engagement pieces through SFBN. We have an outstation, meaning staff that go out into the community to enroll folks into benefits. We reopened it at Wu Yi Children's Services in Chinatown on Clay Street. Open every Friday from 1 to 5. It's really, it's a way to allow folks to deal with issues they have with their benefits or to apply without having to come down right here. And then a recent grant award we got from the American Public Human Services Association, APHSA. We got a $745,000 grant over 2 years, really the focus of the grant is ostensibly to decrease food insecurity. But we really have a much broader vision in mind. And so basically what the grant does, it's one of 4 that were awarded nationwide. There were 22 proposals submitted. We're partnering with the San Francisco Marin Food Bank, and we're going to use the money to purchase a mobile van that will provide outreach, enrollment, and other services on site. So into public housing developments, partnering with food pantries, coordinating with other city departments, Department of Public Health, Disability and Aging Services, and other CBOs to really promote not just our benefits and services, but other resources out in the community. People will be able to apply right in the van. We have an EBT printer, so people can get an EBT card right from the van as well. Again, another way to bring our services out to the community and to break down barriers that historically exist with application for public benefit programs. In CAP, you may have seen this. It got a little bit of press. On April 14th, we resumed operating the Homeward Bound program out of the CAP office. What is Homeward Bound? Homeward Bound is a program that this agency launched in 2005 under Mayor Newsom, which provided transportation to homeless individuals if they wanted to go home, either to a relative, loved one, or someone else who agrees to support them. And basically how we operate the program is through referral or through walk-in. If they say, hey, I want to be reunited with my sister, we would have a social worker actually talk to the individual and ensure that they are agreeing to take the person into their care. And we didn't want to just send someone somewhere else with nowhere to go. When we operated the program before transitioning it over to the new homeless department, we had provided transportation home to over 11,000 people, which we called, an end to their homelessness. Not all homelessness needs to end in San Francisco. When we transitioned it over to the homeless department, they sort of folded the program into a whole set of other services. It wasn't just a standalone, and the numbers have gone down a bit. And so we decided to sort of re-up it in our office where you literally can do a same-day transportation, make it a lot easier. You don't have to enroll through coordinated entry. You don't have to fill out a lot of paperwork. It's really just a real-time connection to family or friends or loved ones. So again, we just launched on the 14th. After we kind of iron out the kinks, we'll probably start marketing it broader across the city to our homeless outreach teams, our encampment resolution teams, so they can, again, have something else to offer, if not just a shelter bed or something else. Say, hey, if you want to reconnect somewhere else, we can provide that. So Family and Children's Services, a couple of really big initiatives that I want to just highlight. The first is we received an $8.5 million award from the State Department of Social Services under their crisis continuum pilot. And so what the Children's Crisis Continuum pilot program really provides a statewide framework for an integrated continuum of care for foster youth who have high needs, sort of significant mental health issues, behavioral health issues, could be substance abuse as well, that are typically harder to place. And so what the continuum does is basically builds upon a theory of change that involves a provider having the ability to direct the entire continuum of service from the highest level of care, so like a psychiatric health facility, all the way down to a family-based foster care or home, right? So kind of highest need, highest service, all the way down to a lower level of service done by a single provider. It's really trying to fully integrate the system of care for the foster youth and enabling kind of a seamless transition between the service settings to help stabilize and treat foster youth who have these high needs. So for us, we're collaborating with Contra Costa County, Marin, and Solano, and Sonoma. We have the $8.5 million will fund two psychiatric health facility beds, four crisis stabilization unit beds, four children's crisis residential program beds, and then four intensive service foster care beds. Again, sort of from highest service intervention down to lower levels. It's really exciting. We're one of, I don't know, I think there are maybe 6 or 8 in the state that got awarded. We're partnering with Seneca as well. So excited to launch this to see if it really can provide a safe setting for youth who have, again, significant needs and hopefully address those needs in a pretty humane and therapeutic way. And then the other piece or the other initiative is it's required, but we, as we like to do in San Francisco, take it a step further. That's a county prevention plan, county child abuse prevention plan that's required under the federal Family First Prevention Service Act, or FFPSA. We're only the second county to submit our plan to the state, 2 of 58. And it's really a very robust and comprehensive prevention plan that spans across the city and doesn't just involve us. It involves community-based organizations, other city departments, in partnership with juvenile probation as well. And it's really system to better identify families who are at risk, families who are in crisis early, so they don't end up in the child welfare system or they don't end up in the juvenile justice system, and provides these continuums of services helped by us, but provided through family resource centers and other community-based organizations. And, I've mentioned before that FFPSA, for the first time ever, allows federal dollars to be used for prevention activities. Federal money through foster care can never be used on prevention. It can only be used on placement. So this is a required element to draw down those federal dollars. The state has to approve the plan, and they haven't yet. We just submitted it a few weeks ago. But it's exciting. It might actually be something we, once it's approved, present to you all, the commission. It's a way to sort of get the word out, helping to get the word out on the plan. And then a couple of celebration announcements. One is our Resource Family Caregiver Appreciation event, which is on Friday, May 5th, from 5:30 to 11 at the South San Francisco Conference Center. You should have all received invites. You can register online if you haven't. If you didn't get your invite or it got lost, Elizabeth can send you out another one. And then we have our Independent Living Skills Program graduation for 2023. This is for foster youth who are graduating from the program and from high school. That's going to be on June 8th at the Firehouse in the Marina, which is at Fort Mason. No need to RSVP. It's from 5:30 to 9, and we will send information out to you as well for that. That's always a really neat event for the kids and for the staff. And then lastly, one of our staff was recognized through the District Attorney's Office of Victim Services. They honored various community champions to kick off the National Crime Victims' Rights Week on April 24th. And Family and Children's employee Gloria Samayoa, who is our Children's Advocacy Center coordinator, forensic interviewer, and ER worker, was recognized as an incredible community leader who's shown unwavering advocacy for victims. And she partners a lot with the DA and with the police department and with the Department of Public Health for kids or youth who are victims of sexual abuse, intensive physical abuse. And it's really a way to, her work at the Children's Advocacy Center allows a youth to be interviewed once and have that evidence collected by the police and by the DA and by us, to help sort of reduce the trauma of being interviewed about a really horrific incident over and over again, which how it was done in the past. So the DA is just recognizing her for her work. So congratulations, Gloria, on that. I'll conclude. Open it up to questions.
Any comments from commissioners? I have to ask for if there's public comment to your report now. So if there's any public comment, please press *3 to go into the queue or raise your hand. No. Okay, doesn't look like there's any public comment, so we will move on to item number 5, Employee of the Month. Danilo Rose. Danilo Rose is a clerk with the Foster Care Eligibility Unit, and he is the April 2023 Employee of the Month. Danilo has been a full-time on-site worker throughout the shelter-in-place and pandemic, providing essential supports to colleagues to allow them to complete eligibility work remotely. His willingness to be in the office scanning documents allowed the Foster Care Eligibility Unit to maintain productivity and responsiveness while limiting potential exposure to COVID-19. His dedication made it possible for the team to maintain payments to resource parents, which you know as foster parents also, without missing a beat, and that was crucial to protecting the well-being of children and maintaining placement stability during a very trying time for all involved. Danilo exemplifies the Family and Children's Services shared value of accountability by doing what he says he will do, being responsive to requests from others, completing tasks in a timely manner, and following policy. Beyond being an essential worker who has made remote work possible for colleagues, Danilo is also always friendly and willing to offer help when it is needed. His dry sense of humor and approachability add to the team's spirit and positive work environment on the 6th floor here at 170 Otis. Danilo, thanks so much for your hard work and contributions, and congratulations. And Executive Director Ward, did you want to add something?
Sure. Congratulations, Danilo. Just real briefly, the Foster Care Eligibility Unit, the behind the scenes work that keep our resource families receiving their cash each month to help support our kids. And, during this pandemic, it was especially important to maintain that, obviously, to maintain places for our kids. Amongst a lot of worry, I think, from our resource parents, frankly. And so for you to come in every day to ensure that that is going to happen, really appreciate it. It feels, sort of above and beyond the call of duty, but you really stepped up, and that's why we're recognizing you today. So thank you very much. It's very well deserved.
It's not forced, but might want to introduce your mom.
Danilo.
Oh, by the way.
Mom.
Let's be real quick, because I know you have a lot on the agenda. So, as well as they were responsibility, mission, as well as, so I know, I understand they have the resolution from the once a year. I thought it was supposed to be that here.
Okay, we're gonna.
So if Employee of the Month folks want to leave, feel free. So for item 6, do any of the commissioners want to remove an item for individual discussion? Nope. And we'll open public comment at this time. Please press *6 to be added to the queue or raise your hand. Doesn't look like we have any public comment. So is there a motion to approve the consent calendar?
So moved.
And all in favor? All right, that's good. Thank you. Item 7 is action items. 7A is a request to adopt a resolution proclaiming May 2023 as CalFresh Awareness Month, and I believe Philip Mao will present.
It's just automatically.
Good morning, Commissioners. Good morning, Trent. My name is Phil Mountain. I am the Director of Limited Guidance. I'm here today requesting adoption of the resolution proclaiming May 2023 as CalFresh Awareness and Action Month in the City and County of San Francisco. Whereas this resolution declaring May 2023 as CalFresh Awareness and Action Month in the City and County of San Francisco, and urging all community members to support efforts to increase awareness of and participation in the CalFresh program. And whereas access to safe, nutritious, and culturally acceptable food is basic human right and essentially to human health. And whereas food security is the foundation of a strong and healthy community. And whereas food security in San Francisco has risen to historic proportions during the pandemic, CalFresh has played a critical role in filling the gap. And whereas during the health emergency, the federal government has allowed states to waive requirements that clients participate in an interview as part of the CalFresh application process. In the past, we could deny a complete application for a missing required interview. This is not currently the case. And whereas in recognition of many students who are struggling with food insecurity, the federal government instituted a waiver during the pandemic, easing access of students to SNAP. As such, the nation has expanded student eligibility to include more who qualify via work study or using expected family contributions as income indicators. And whereas San Francisco Human Services Agency opened 3 out of 4 SF benefits net outstations following COVID-related closures. Eligibility workers continue to be co-located at these outstation sites, providing CalFresh and other benefits enrollments to the San Francisco residents. And whereas San Francisco continued its contract with 211 San Diego to expand CalFresh access and increase food security. On a weekly basis, staff from 211 San Diego conduct telephone outreach to approximately 100 individuals who are receiving medical benefits and likely eligible but not yet receiving CalFresh, to see if they are interested in obtaining assistance in submitting applications online, which San Francisco Human Services Agency eligibility workers then process. And whereas when funding from the federal process and technology improvement grant, our key partner, the San Francisco Food Food Bank, has launched a new program to increase the number of My Benefits CalWIN or MyBCW client accounts with the end goal of 1, decreasing in-person lobby transactions, particularly relevant during the ongoing pandemic. 2, learning how low-income persons, namely those with limited English, experience technology so that agency can engage them in the future technology developments. MyBCW is an online application portal that allows individuals to create personal accounts that make it possible to use one's personal computer, tablet, or cell phone to submit benefit applications, among other functions. To date, the San Francisco Food Bank has assisted approximately 1,000 CalFresh recipients in signing up for MyBCW accounts. And whereas SNAP agencies throughout the nation are currently waiving all work requirements, and whereas Market Match allows a CalFresh household to expand the value of their benefits, farmer markets will double the value of purchases made using CalFresh EBT. This promotes healthy food options, supports farmers, and extends the client's CalFresh budget. And whereas online EBT services have established for such food distributions as Safeway, Amazon, and Whole Foods to expand access to permit households to use CalFresh food benefits for online purchases and deliveries. And whereas EBT food benefits usage at farmers markets in San Francisco soared in 2022 to over 6.5 million, compared to about 2.5 million in 2021. And whereas San Francisco continues to offer restaurant meals programs, allowing homeless, seniors, and federally disabled to use their CalFresh allotment to pay for meals in designated restaurants. This increases the access to hot meals for those who don't have easy access to kitchens. And resolved that the San Francisco Human Services Commission proclaim May 2023 to be CalFresh Awareness and Action Month, and urge all community members to support efforts to increase awareness and participation in the CalFresh program. Thank you. Are there any questions?
How does this one beyond this room?
Division in promoting more clients to apply for our benefits. We're partnering with a lot of our CBOs as well. We're actually expanding with our higher education as well, because we have a lot of students who are qualified to apply for these types of benefits that they don't know about it. So we're working with them right now with the partnership because of AB 1326. We're partnering with higher education.
I'm going to open public comments. Star 3 or raise your hand. Give it just a second. Not seeing any public comment. Is there a motion to approve the resolution?
Second.
All in favor? Thank you. Thank you, Commissioner. Item 7B is requesting adoption of resolution proclaiming May 2023 as Foster Care Month. We have Sophia Isom and Angela Ramos.
Good morning. Morning, my name is Angela Ramos Hayes. I'm Program Manager in Family and Children's Services Division, and we have the oversight of the Family Resource for units. This morning I am here with our Deputy Director, Joan Miller, my Program Director, Sophia Isom, to respectfully proclaim the month of May to be Foster Care Awareness Month. In FCS, we support children who are victims of and were at risk of child loss and neglect. This is one of the most important mandates within the San Francisco HSA. Realize that our approach to foster care parents and relative caregivers is extremely important in the life of every foster child in our system. In attendance today with us are some of our foster parents, some of our members of our leadership team, our analysts of the day, supervisors, spouse, mom. My program director. I want to give special acknowledgement to our resource parents and FCS staff. Foster parents and relative caregivers dedicate their love to foster children by taking care of and putting work hours a day, 7 days a week. They truly give unconditional love and support to children and young adults. At times, it may feel like a thankless job. I have seen firsthand what some of our caregivers do for our children based in our homes. Transportation, enrichment activities, get them to and from school appointments, but the most important thing that they can give is unconditional love, along with a safe and supportive environment. Special recognition should be given to everyone that is dedicated to support youth and young adults in the San Francisco foster care system. Specifically, protective services workers, social service technicians, supervisors, clerical staff, foster care eligibility workers, placement, and RFA workers, analysts, and administrators. It takes a team effort among caregivers, staff, service providers, and community partners to ensure the safety, well-being, and permanency for foster children and our non-minor dependents. Staff and FCS would not be able to do our jobs without the help of resource parents and relevant caregivers. I wanted to just highlight that usually we tend to do foster care appreciations. During the pandemic, it was not in person, but we are doing it this year in person, and we look forward to seeing everyone there. It is going to be next Friday at the South San Francisco Conference Center. I also wanted to highlight We are so committed to making an effort to increase the number of foster homes in San Francisco. This will be done in collaboration with our HSA communications teams to conduct a media campaign. And they're looking forward to everyone on that. For planning, 13 names, we can declare foster care month. Whereas the family is the foundation of a strong and healthy community, and whereas in San Francisco, there are 618 children in youth and foster care, and whereas in San Francisco, there are 138 foster homes in non-minor dependent status. Whereas foster parents, including relative and non-relative extended family members, provide an essential service to the community and care for children and youth in foster care. Whereas the importance of a family structure is best served in foster homes that model family living as opposed to homes. And whereas the stability and permanency for children in foster children is the utmost importance. And whereas permanency is defined as both a process and result that includes the active involvement of a child or youth. And whereas permanency is defined as a permanent connection with at least one committed adult, which may be biological, character, reunification with another adult family member, victim kin, adult siblings, or other individuals in the child group's lives committed to the child for adoption or guardianship. And whereas it is the responsibility of the entire community to make sure that each child will leave the foster care system in California has a permanent lifelong connection with the community. And whereas San Francisco is in need of dedicated care providers who strive in partnership with the Human Services Agency to identify and connect children and youth in foster care to permanent lifelong relationships. And whereas dedicated care providers model strength-based and solution-focused engagement with the children and youth in their care, the community-based and government entities providing services and support, and whereas community-based organizations within San Francisco partner with the Human Services Agency to provide accessible and mutually relevant family-centered services that meet the needs of the families and children we serve. Now therefore be it resolved that San Francisco Human Services Commission proclaims May 2023 Foster Care Month and urges all community members to volunteer their talents and energy to honor children and youth in foster care and those who have exited the foster care system during the last year.
And good morning, Commissioners. I'm Sophia Isom, and I just wanted to take a moment to say it's been an honor working with you throughout my career at HSA. I'm going to be retiring really soon, and I just wanted to say I truly appreciate the support that you have given to our foster youth caregivers, non-minor dependents, and all of the staff at Family and Children's Services. Thank you so much. Yes.
Foster care parents, when they've been part of your program, and everybody speaks so very highly of you guys, so we appreciate you.
All right, yeah, thank you. Thanks.
We'll open public comment at this time, *3, or raise your hands. In a minute. Doesn't look like there's any public comment. Is there a motion to approve the resolution proclaiming May as Foster Care Month?
Second.
All in favor?
Celebration of Ms. Isom's great.
Thank you. Item 7C, it's a new grant agreement with Urban Alchemy and Vladimir Rudakov.
Good morning, Commissioners. Trent Vladimir Rudakov. I'm the Director of Program Integrity and Investigations for Human Services Agency, and I'm here today to respectfully request authorization to enter into a new grant with Urban Alchemy for the period of May 1st, 2023 to June 30th, 2025 in the amount of $2,079,458, plus 10% contingency for a total amount not to exceed $2,287,404. The goal of this grant is to provide street safety monitoring services around our facility at 1235 Mission Street. Access to 1235 Mission Street facility has recently experienced an uptick in disruptive activity that negatively affects both HSA staff and clients that we serve. Alchemy staff will provide safety and de-escalation services and that will increase the sense of safety and security on the exterior area surrounding 1235 Mission Street. Services will be provided from Monday to Friday from 7 a.m. to 6 p.m. Thank you.
We'll open public comment at this time, *3, or raise your hand. Doesn't look like there's any public comment. Is there a motion to approve the new grant agreement with Urban Alchemy?
Second.
All in favor?
Inclusion of the parking lot.
Work that you're going to be doing during the time. Thank you. Yeah. Yeah, thank you.
All in favor?
Aye.
Oh, I'm sorry. There is public comment. Apologies.
Hi, this is actually not a public comment, but this is Dar Singh's daughter, who is one of your members, and our *6 is not working. We called the commission already, but if he needs to vote in absentia, we're not sure how to unmute. It's not allowing us on each of these motions, and this is the only way I could get hold to the line. So I just wanted to note that. So he is present at the meeting, listening, trying to vote, but we are not able to access it through the *6 unmute function.
Okay, thank you so much for letting me know. I apologize for that. I'm not sure what's going on.
Yeah, so if you'd like, at the time of the vote, I'm helping my dad today for the first meeting while the WebEx is getting set up for next month. I don't mind doing a raised hand, but I want to make sure his vote is getting counted, and he's here listening and voting, but he's not able to get off the mute button. So I just wanted to make that. And I'm so sorry for interrupting in this way by doing a raised hand, but that was the only way I could get unmuted on the phone.
I think that will work perfectly if you don't mind. We will look at the screen for the raised hand when we request the motion or do it all in favor, if you're okay with that.
Absolutely, and I'll stay with my dad. I'm working from home today, so I'll stay with my dad for the meeting, and then I'll let him do his vote that way, and he will get on the line when he raises his hand. Thank you so much.
Thank you. Thank you so much.
Who's she talking to?
So he is unmuted, but anyway. Okay, item 7D, Brenda Williams is presenting a request for a new grant agreement with Seneca.
Good morning, Commissioners. My name is Brenda Williams, an administrative analyst with Family and Children Services Foster Care Eligibility Program. The Department of Benefit and Family Support is requesting authorization to enter into a new grant agreement with Seneca Family of Agencies for the period of July 1st, 2023 through June 30th, 2026 in the amount of $200,000. The purpose of this grant is to provide safe and secure transportation for foster youth with complex and challenging medical, mental health, and behavioral needs to placements inside and outside of San Francisco. Approximately 40% of San Francisco foster children are placed out of county. Family and Children Services place youth all over California, as well as placements out of state. Any change of placement can be traumatic, and for children and youth with complex and challenging needs, it can be a very vulnerable time. Some youth pose a danger to themselves and/or others and need a more secure and supportive transportation option than what can solely be provided by a protective service worker. For these rare occurrences, Having specialized and highly trained personnel is essential to ensure youth is transported safely to a placement. This type of transport usually involves a youth who is quite resistant going to their new placement and has usually exhausted all other possibilities for placement. Specialized treatment for some youth can mean being placed unwillingly out of state or at a placement not of their choice, and other less secure options of transportation have been exhausted. As a result of the secure transport contract with Seneca, many youth have benefited from the professional and experienced staff and were transported to or out of San Francisco safely and successfully. Seneca has met their annual contract objectives and outcomes throughout the duration of our partnership and continues to put in every effort in serving each youth needing services. I'm happy to answer any questions that you may have regarding this request. And also joining me today is Juliet Halverson, Foster Care Eligibility Manager, as well as Contract Manager Johanna Gendelman. Thank you so much for your consideration.
Juliet? Commissioner Fly, one thing. Recent change last year by the state of California now forbids county human service, county child welfare systems as well as probation from placing out of state. So I just want to clarify for the record that even though the memo says we used to place some kids out of state, we no longer do that due to the changes in the state regs.
Yeah, for congregate care, that is correct.
Right.
That was the.
Correct. That's true. If they're placed with relatives, they can be placed out of state. Yes.
And I'm gonna, for Commissioner Singh, if you want to vote, Commissioner Singh, please press first *3 and then *6, and we will, oh, sorry. Okay, just push *3 and we will register your vote. So let's give this a try right now. After we ask for public comment. So we'll take public comment at this time. And it doesn't look like there's anyone in the queue, so I will ask for a motion to approve the new grant agreement for Seneca.
Second.
Thank you. All in favor, and let's try Commissioner Singh, *3. Thank you. Yep.
All right.
Wonderful. Thank you. That worked. So we'll try doing that in the future. Thank you.
Thank you.
Okay, it's been approved. Moving on to item 7E. New grant agreement with Asian Week Florence Fang Community Farm, presented by Cindy Lynn.
Morning, Commissioners. My name is Cindy Lynn. I am the citywide food access manager here at HSA. Nice to see you all again. Today, I'm here to request authorization to enter into a new agreement with Asian Week Foundation doing business as Florence Fang Community Farm for the provision of the Farming Toward Food Security Program for the period of May 1st, 2023 through June 30th, 2024 in the amount of $415,000 plus a 10% contingency for a total grant amount not to exceed $456,500. This is the result of a RFP we released a couple of months ago called Farming Toward Food Insecurity. The idea behind it was to support some of the larger produce producing farms here in San Francisco and giving them the opportunity to give their produce that they grow here in San Francisco to existing food service providers here in the city, kind of keeping what we grow here consumed here. In this grant, we are also supporting internships and apprentices so that they can learn about urban agriculture. So this grant will allow for 21 interns and the growth of over 20,000 pounds of food during the grant term. The Florence Fang Community Farm is located in District 10. It is a little bit over an acre, and it has a very robust support system in the community of volunteers who come and grow the food, who keep the place very, very bee-friendly, if I might say. I've been there myself. And so that's what this grant is for, and happy to answer any questions you may have.
Commissioners?
I would just add that in. The work of Florence Flang, it's very important and much supported.
Thank you, Commissioner. We'll open public comment at this time. Doesn't look like there's anyone in the queue or any raised hands, so is there a motion to approve this grant agreement? Thank you. Second? Okay, all in favor? Commissioner Singh, star 3?
Yes.
Wonderful, got it, thank you. It's approved. And you are here for item 7F also. Thanks, Cindy.
I'm going to request.
Do you want to write?
A new grant agreement with Earth Island Institute, doing business as Friends of the Alameda, for the provision of also the farm towards food and
Program for the period of May 1st, 2023 through June 30th, 2024 in the amount of $415,000 plus a 10% contingency for a new total amount not to exceed $456,500. This is for the same purpose, but for a different farm. Alamany Farms is located sort of off the freeway off 280, very close to the Alamany Farmers Market. If you've ever been on Saturdays, this farm is about 3 acres. So their goal will be to host 15 interns through the grant term, but to produce over 35,000 pounds of food. And so right now, Alamany, they are already very active in giving their produce back to the community. They have such programs that either allow participants to come and pick their own food at a time that works for them. And they already train a couple of apprentices, but through this grant, they will be able to sustain apprenticeships throughout the whole grant term. Both grants are focusing on hiring BIPOC interns to give them the opportunity to learn about urban agriculture. So yeah, same program, 2 separate grants, 2 separate grantees. Happy to take any questions for Alamany Farms.
Thank you. Right, star 3 is your go-to. We're going to open up public comments. Okay, I'm not seeing any hands raised or anyone in the queue. Is there a motion to approve the new grant agreement with Earth Island Institute Friends of Alamany Farm?
Second.
All in favor?
Yes.
Thank you, Commissioner. Okay, it's approved. And FG, 7G, Cindy.
Right, the last item that I will present
is I'm here to request authorization to modify an existing grant agreement with the Chinatown YMCA for their sponsorship of the Chinatown Food Giveaway for the period of May 1st, 2023 through June 30th, 2023 in the additional amount of $154,500 plus a 10% contingency for a revised total grant amount not to exceed $397,828. The Chinatown YMCA for this year has agreed to support the annual Chinatown Food Giveaway event. This is an event that I also brought to the commission same time last year. This is our second time supporting this event, and the Chinatown Food Giveaway has happened every year since 1996 until the COVID pandemic hit. And so we're trying to help them revive this event. Every year they give away food to 5,000 people all in one day. And the focus of the Chinatown Food Giveaway is to give very culturally specific items that food insecure community members typically cannot receive at the more standard food pantry, food access point programs. And so today I'm here to seek authorization to enter to modify the grant we have with the Chinatown Y, as this year they have agreed to fiscally sponsor this event.
Questions or comments from commissioners? Again, Commissioner Singh, if you have any questions, *3. We're going to open up the public comment line. Raise your hand, *6. Not seeing any public comments. Okay, is there a motion to approve the modification of the grant with Chinatown YMCA? All in favor? Commissioner-
Yes.
Wonderful. Thank you, Commissioner Singh. It's approved. Item 7H is a sole source waiver and new grant agreement with Chapin Hall. Tara Ness.
Good morning, President Khan and Commissioners. My name is Tara Ness, and I'm a Program Support Analyst with our Policy Planning and Public Affairs team. I'm here today to seek your authorization to approve a sole source waiver and enter into a new grant agreement with Chapin Hall at the University of Chicago. This is for the provision of a local evaluation of the guaranteed income for extended foster youth pilot program for the time period May 1st, 2023 to April 30th, 2028. Before I discuss the details of this contract, I would like to provide some context for this project. As Director Rohr has shared with you previously, we are one of only 7 entities and only one other public agency across the state to be competitively awarded a grant from California Department of Social Services to administer a guaranteed income or GI pilot. In addition to the state grant of $3.3 million, we raised $1.3 million for a philanthropic partner, the Tipping Point community. The pilot will provide 150 former foster youth $1,200 a month for 18 months, no strings attached. State and local research institutions will be evaluating whether regular, unconditional monthly cash support positively impacts the outcomes of GI recipients. The pilot will be managed by our Child Welfare Division. They will be coming to you next month to present multiple programmatic contracts related to the pilot. We are bringing this local evaluation contract to you all now because Chapin Hall needs time to prepare their work plan and survey tools before the pilot gets started. This contract will support a local evaluation of the GI pilot as a complement to a larger statewide evaluation. Under this grant agreement, Chapin Hall will employ a quasi-experimental design to evaluate the impacts of guaranteed income and optional support services, such as financial coaching. Key deliverables will include an evaluation plan, monthly data dashboard with enrollment figures, and 5 written reports at various stages along the process. Chapin Hall will also provide presentations to key stakeholders with research findings along the way. Additional deliverables are outlined in Appendix A. Chapin Hall has extensive experience and reputation in child welfare research aimed at facilitating public agencies and improving policies and programs. This includes a decade-long history of successful collaborations with our agency. Given their experience, we propose in our state application to work with Chapin Hall as our local evaluation partner. We are requesting a sole source waiver to fulfill the proposed project design. Thank you for the consideration. Happy to answer any questions you may have.
Any comments or questions from the commission?
Like this is going to be an iterative process in the sense that you get the money in place and then you get the concepts flushed out and then selection of the youth.
Sure. So we do have our approximately 150 youth participants identified. And we are in the planning phase, and I think that FCS will be able to speak a little bit more in depth about the pilot itself next month. But we are fully in the planning phase and hoping to get things started in the next couple months.
Could summarize it. What is the goal for each of the 150 youth?
Itself will be providing $1,200 a month for 18 months, as well as optional support services. That includes financial coaching, benefits counseling, and case management. This is for former foster youth as they're aging out of foster care. And so the hope is that this, and I think our research hypothesis is that this sustained support will help them foster independence and transition into adulthood, especially given the context in San Francisco, knowing and the nation. that it's tough out there, and especially in San Francisco. So hoping that positive outcomes, well-being, just housing, financial support, et cetera.
What is the criteria?
50, is that all of the foster youth in or that are aging out, or is that?
Another good question. Primarily, based on the state application. For San Francisco, it will be all foster youth as they're aging out or emancipating from extended foster care, calendar years 2022 and 2023.
This time? You like the formal? Oh, you have a question?
No, no,
For sure? For sure.
no. I'm just. People.
This, this could be an exciting project. I would hope that we would find ways to let the community know that it takes a village and, you know, this is our contribution and you got 18 months or whatever it is to make, so that we're in this together, because this is exciting. And I understand from what you're saying, Chicago is going to be devising plans to share with the nation around guaranteed income issues. Yeah, so, why?
There's a lot, I think. And the collective, we don't know about the impact of guaranteed income, right? It's really, you know, Stockton did 500 families under Mayor Tubbs years ago. And so to your question about the evaluation being iterative and what are our goals? I mean, I think our broad goals is to hopefully that they're in a better position in life 18 months down the road than they would have been absent this money. But who knows what the other goal, you know, is it higher education attainment? Is it more stable jobs, more stable housing? Do they move, you know, so, you know, guaranteed income is being pushed out a lot in different states and across the state. And I think it's just be interesting to see what the impacts really are, as opposed to the cash assistance that we provide that generally, you know, you have to fit into certain requirements and sometimes do, you know,
And I have a question.
work, et cetera.
Won't disqualify them from other services that they might be entitled to.
That's a great question. We have waivers, public benefit programs to allow them to apply for CalFresh, CalWorks, et cetera, and working on it for CAP. Yeah, good question.
Hi, Commissioner Susie Smith, Deputy Director of Policy, Planning and Public Affairs. The only other thing I wanted to add is that there is, as Taryn mentioned, a statewide evaluation. Because we're like a statewide program, and Urban Institute is doing that evaluation, and they're actually doing a random control trial where half the people will get the intervention, half the people won't. And in our case, we weren't going to do that approach for the youth. So we're doing what they call sort of quasi-experimenting, or we're trying to find a group. But we really wanted the local evaluation because our service stuff is different, you know, we're more robust, and we really want to understand, does this work? What are the ingredients that work or don't work for this population in our context, in particular around housing? And so, to Big Point, you mentioned that we raised private funds for the match, and to Big Point Community Foundation, they really are partnering with us on this because they want to know, does it work? As Ms. Trent said, there's been a lot of GI is sort of touted as working for everybody. Maybe it does, but rigorous evaluation will help us answer that question. Or under what conditions does it work, and for whom and why?
Next time I move along, just holler. Okay, now we'll open public comments at this time. Not seeing any hands raised, no one in the queue. Okay, is there a motion to approve? Thank you.
Second.
All in favor?
Aye.
Thank you, Commissioner Singh. We heard you. It's been approved. Thank you, Taryn. Item 7I. New contract agreement with fiscal experts. Heather Davis.
Good morning, Commissioners. My name is Heather Davis, Revenue Manager in our Finance Division. I'm requesting authorization to enter into a new contract with Fiscal Experts Incorporated. The purpose of this contract is to provide a web-based time study service to up to 1,750 Human Services Agency employees and up to 50 Juvenile Probation Department employees to assist the department with claiming employee time and associated costs for a wide variety of programs to all of our agency's vendors, though primarily to the California Department of Social Services, CDSS. Employee time studies are the single largest component of our quarterly county expense claim to CDSS, which includes between $100 million and $200 million in administrative costs in every quarter. The time study tool and help desk funded through this contract will allow time studying to be as easy as possible for our employees, to streamline reporting and facilitate proper claiming of federal and state revenue. The funding sources for this contract are 75% county, 13% state, and 12% federal, which is similar to prior contracts with Fiscal Experts for this service. And if the commissioners have any questions, I'm happy to answer them.
In the document, as required by the state, that line jump, what does the state require in this regard?
Our sort of caseworker staff, the staff that work directly with clients, that they time study at least on a quarterly basis, so at least for 4 weeks in the middle of every quarter. It's a very integral part of our claiming process because when they're time studying, they are noting how much time they spend on different types of programmatic activities. It's not really a record of were they working or not working, track that too, but it's more about how much time they spend doing CalFresh enrollment or Medi-Cal benefit eligibility work or foster care eligibility work and the various flavors or different types of social work programs. And so the state has a cost allocation plan that they get approved from the federal government. And so we are complying with that statewide cost allocation plan by having our staff time study county welfare requirements across the state. We all have the employees all have to time study. This request is to enter into a contract with Fiscal Experts because they have a tool which makes it as easy as possible for the employees to complete that time study and for them to get the sign off on it, to submit it, for their supervisors to approve it and sign. We have the electronic signature capability. And for all of the reports that we might need or want to have to help us file a claim with accurate information.
What I'm really searching. Is it more we are studying time for the organization or studying time for the client that impacts their improvement in life?
It is just, it's studying the time that our agency staff spend doing their.
Get real technical.
Different level of federal or state dollars. So Medi-Cal, for example, we get federal and state a much larger amount than we would for, say, CalFresh or CAP. So.
Taste on it if you'd like. And the former item that's submitted,
outcomes for our clients. And I just wanted to try to sense how much of this is me worried about my work job rather than how much I've given to the clients.
It's more about the money.
Gotcha. About the money.
Any other commission? No. We will open public comment at this time. Doesn't look like we have anybody in the queue, so close public comments. Is there a motion to approve item 7I? All in favor?
Aye.
Thank you, Commissioner Singh. It's been approved. We got it. We are changing it next month. Okay, item 8 is general public comment. At this time, we can take general public comment on any matter within the subject matter jurisdiction, the Human Services Commission. So we will just wait one moment, to see if anyone raises their hand or enters the queue, *3. Do you want to adjourn, by the way? Do you want to adjourn the meeting? Okay. So it doesn't look like there's anybody in the queue. We do not have general comment. So item 9.
Thank you.
Thank you, Commissioner Singh.
Yes.
All right, take care. You can log off now.
Aye.